I would like to tell you about AceTech, and I really loved that line, Daniela, how aloe vera went digital. So our vision and mission is to be a leader in precision medicine for supportive care and in wound healing. And our story actually begins far away from Israel and far away from Germany. This is Costa Rica, where our business partners extract a functional ingredient, a unique functional ingredient from aloe vera for the use in wound healing. And these products are in the market for quite some time. But when we joined them, we realized that wound healing and certain types of supportive care are still a little bit behind with anything that relates to precision medicine and digital health. So that's why we started AceTech with the aim to add the precision medicine approach to this field. And our first focus is on oncology supportive care. And we all know that common cancer treatments such as radiotherapy and chemotherapy are associated with a very wide variety of side effects, from light ones to very severe ones. Two of the most common and painful ones are oral mucositis due to chemotherapy and certain radiotherapy treatments, and radiation-induced dermatitis, which is a skin reaction to radiation treatment. And that's our first focus, radiation dermatitis. In this case study, for example, Lisa, who's 43 years old, was diagnosed with breast cancer. She has pretty high chances of going radiotherapy for her tumor. And unfortunately, 95% of breast cancer patients undergoing radiotherapy will suffer from radiation dermatitis to a certain degree. Further, 63% will deteriorate to a higher degree of radiation dermatitis. And out of them, 32% will reach higher levels that are critical. Grade 4 radiation dermatitis actually calls for a stop in the radiation treatment in order to let the skin heal. It's that severe. And of course, this negatively impacts Lisa's quality of life and the patient's quality of life. And it's an economical burden on the system that has to stop and treat that as well before continuing with the regular radiation treatment. So what we are trying to do, and how can we help Lisa? So today, the current approach is disease management. Those who will deteriorate will receive the treatment, which is topical preparations, antibiotics, and corticosteroids. And AceTech as well offers a topical preparation for radiation dermatitis. But as I've mentioned, we realized that there has to be something different. We're trying to look and create the field of pre-treatment. We're trying to predict which of these patients will deteriorate to higher degrees of radiation dermatitis and to take preventive measures to prevent that from happening, to keep them at either very low levels of radiation dermatitis or hopefully even preventing it altogether. How do we do that? We're saying that we're connecting the dots across verticals. We want to reach better health outcomes by tying skin microbiome measurements and personal characteristics with big data and AI that can help us today. And the outline of our solution is this. We're collecting and analyzing data today from medical records, from the treatment plan as scheduled by oncologists. We do not interfere with that. We just look at the parameters. And we look also into personal characteristics and skin microbiome swabs. And we're creating a personalized output, a personalized risk assessment score of what are the chances of suffering from high degree radiation dermatitis. And following that, we can design a tailor-made prevention plan, giving the right patient the right dose, the right treatment, and at the right time, meaning before radiation treatment, during, at what intervals, in order to minimize radiation dermatitis and improve the overall health outcomes. And these are screenshots from our solution. It's a professional use software tool, so it's either going to be used by a physician or I think more often, especially what we see across Europe and in Israel, nurses, wound healing nurses or radiotherapy nurses that actually see the patients week after week and do the follow-up and look at the skin's condition. They will be able to assist this tool in order to customize the treatment plan. And why do we look at the skin? We're looking at all the parameters, but the skin is especially interesting. We know that microbiome has been a buzzword in the last few years, especially gut microbiome, and we think that skin microbiome got a little bit overlooked. And we know today that healthy skin is associated with high diversity of microorganisms, and of course there is interpersonal variation. And many disease states are affected and can be seen with a change from healthy state of skin microbiome to a disease state. So we're trying to use that as a biomarker and as a preventive measure. And we're currently running a clinical trial. We're more than halfway through recruiting. It's here in Israel in Rambam Medical Center, and we're exploring this correlation between the skin microbiome profile, breast cancer patients, and the severity and occurrence of radiation dermatitis. Results are expected later this year, and we're very excited. Very few research groups worldwide have even looked into this connection. And I should mention, just a couple of days ago, we saw that Johnson & Johnson themselves are starting to take more interest in oncodermatology and are formulating products with probiotics for skin microbiome. Sorry? No? Okay. So just a word on our products that I've mentioned before. They all contain a unique functional ingredient called Acemenon, which is derived from aloe vera. Unlike common aloe vera products, as you can see here, product A, B, and C, the Acemenon that we produce in Costa Rica is the closest to real fresh aloe vera. It's a very large molecule, between 1 to 2 million Dalton. So it's a very big technological challenge to preserve it in its full size in order to enjoy the benefits of this product for wound healing, which includes anti-inflammatory effects, immunomodulatory effects, macrophage activation, cell proliferation, tissue hydration, pain relief. It can serve as a barrier against contamination, and it helps accelerating wound healing. And our products are in 3 categories: oncology, supportive care, dental care, and burns and wounds. And that's closing the cycle of the suggested treatment. And this is just a little bit of a clinical from the products to show you, again, aloe vera and its properties. And this slide, you can see that the Acemenon hydrogel helps accelerate wound closure in diabetic foot ulcer patients. Just to summarize everything, we're vertically integrated. We're starting with a plant, extracting functional ingredient, we're formulating and producing final products, RX and OTC products, but moreover, and this is what we think gives us that special spice, is we're looking into expanding and do this precision medicine solution in order for the entire chain of wound healing cycle to become more effective and more precise and personal. These are our partners, Skin Microbiome Research from the Hebrew University. We're running 2 clinical trials, one in Rambam and one starting now in Asuta. And Natural Aloe are partners in Costa Rica. And in Germany and Ruhr, we'll be happy to form partnerships, look into distribution agreements, and look into research and case studies in order to develop the technology. So we'll be happy to hear. If anybody has any questions, I'll be happy to answer them. Thank you.